My name is Ehsan Porshirazi. They call me Dr. Porsche. I love people. Number one, I really love people. What I really care about is people's well-being. So in recent time, we actually had a patient who came in just from memory. She came in for a consultation and she said, "I'm absolutely gorgeous, but I just never smile. I don't like my smile." And there was a lot of challenges that she was having with her oral health. And right then and there, I knew that we're going to have a great transformation. She's going to start smiling. She's going to feel good. And when she came back after her treatment, about a couple months after, when I met with her in recent times, when she came back and she said, "Look, you don't just put smiles on people's faces, you put smiles on their hearts." And that really touched me, and that really makes sense, and that goes along with what I was saying with how the people feel good here and in their mind and their confidence and self-esteem. It really affects them in a positive way, and that's what I really like. People have a lot of dental anxiety about actual procedure, and unanimously, after everybody's done, they say, that was a lot easier than I thought. So it goes from somebody who has a lot of anxiety, and let's say it's 100, and then they're like, what, that was more like a 5. And so I go over that process with the patients. And during the interviewing process and meeting the patient, I know what type of treatment the patient needs. Not only that, then we also know how we should do the treatment. After they go home, they're also surprised on how little they have discomfort. So people are overwhelmed with joy all the time. When they come in, they have some sort of story, right? They haven't had teeth for a long time. They have a lot of broken teeth for a long time. They have infection that they've been dealing with for a long time. And my heart goes out to them. But when we're done with the treatment, they're overwhelmed with joy. There's a lot of happy tears and happy smiles, and they're happy that it's finally over and their nightmare is over, and they get to be able to eat, smile, laugh, be confident about their smile, secure with the treatment that they received, that they don't have to worry about it for a long time. And that really not only touches us, but it really touches the patients when they're done. And that we see that process over and over and over again. What sets us apart is that we're really patient-centered. Our patients are number one. For me and my team, our patients are number one. And the treatments that we give them, I always tell my patients, anything I do on you, I would do on my own father, mom, sister, brothers, family members. Any material that we use, I would use on myself and my own family. And that really has a positive effect with patients when I first meet them and I tell them that, so that they actually understand how we are and what we would do things. I wouldn't do anything that I wouldn't want done on myself or my family members. The next step is our consultation with the patients. I feel that majority of people don't know the type of treatment that we do here. They don't understand it well enough, and their perception is a little bit different. It's just like any field. Just like if I go into another field and want to talk to an expert, I don't know that field, so I want to get educated by that person. So I feel that part is very important, and I spend a lot of time with my patients in the beginning, explaining everything, explaining their options, explaining the pros and cons of everything that they need to know, because that part is important before they make their decision of what type of treatment they should get, if any. So I also feel that part is very important, and so that the patient doesn't feel pressured into any type of treatment, and they're feel welcomed in the office. Then the next step is the actual work. A lot of the work that we do is 2 parts, surgical and prosthetic. My passion is implant dentistry and any related surgery that involves implant dentistry and the prosthetic portion. Those 2 parts go hand in hand, and if you don't have a successful surgical treatment portion, you will not have a successful prosthetic portion. Another thing that people should know is that their treatment is a long-term treatment. It's not get it done and they can forget it forever. Maybe for a single implant that they get, it's doesn't have to be a long-term treatment or a long-term conversation for their dental center, but especially on the full mouth rehabilitation. People should consider having a long-term relationship or a ongoing relationship with their center, and that's what we have here. I always tell the patients when I talk to them, I said, look, I'm going to know you for a long time. You're going to get this done, and you still have to take care of your treatment. You still have to clean it on a daily basis. You need to come back here for the hygiene appointments and cleaning appointments, so that we could keep an eye on things and make sure that everything is in proper order for you, so that you could have this as long term as possible. Explaining that to the patients is important, but at the same time, a lot of patients may not know that. And so for me, I feel very good that I have that passion about what I do, because I absolutely love every single day when I'm in my practice working on a patient or talking to a patient about treatment or after the treatment. I feel like that part is very important, because then from the start to finish, we have success. And we have to have a very high degree of success rate so that we could continuously do a very amazing job for every single patient that walks in.